DREDF presents Healthcare Stories. Dr. Clarissa Kripke, Gordon Reitz, Susan Lee, and Aaron Reitz. Part 4. Interviewed at the Ed Roberts campus, Berkeley, California, October 2012. The sound of Aaron paging through books can be heard throughout the interview.
What we're talking about is really developing a new field of medicine. There really isn't a board certification or training program in developmental medicine or developmental primary care. Those are the few people that are working in this area are self-taught based on their own interest and initiative, and most don't actually have any special funding, so it's very limited. Our capacity to provide the services to everybody is quite limited. Over the last 40 years, we've done an amazing thing, which is most people with complex disabilities, developmental disabilities, lived in institutions 40 years ago. And we have done an amazing thing to close almost all of the institutions, and the few that are still open are in the process of closing, and to develop good lives for people in the community. 40 years ago, the life expectancy of people with developmental disabilities was quite limited. There were very few people that were living long enough to outlive their parents' ability to advocate for them. So we knew we needed to develop special education. We knew we needed to develop developmental pediatricians and specialty services for kids, but we really weren't thinking in terms of people benefiting from those resources and living longer lives. But now we have a whole generation of people who have thrived as children, who have developed skills in special education, who have vocational skills, who want to work, who want to participate in their communities, and who want to enjoy themselves. And we don't have a system in which, a healthcare system for them to graduate to. The Office of Developmental Primary Care at UCSF was established to help improve the capacity of the healthcare system to serve the population of transition-age youth and adults with developmental disabilities. The model that, the components of a comprehensive model of care for this population includes the CART model, which stands for C is for CART, is for clinical services, which is both special primary care and specialty services. The A is for advocacy, both advocacy to support patients to partner effectively with their healthcare professionals and policy advocacy. And the R is for research, which is research in health services delivery and health policy and clinical research. Not so much research on cures or prevention or etiology. And the T is about training and technical assistance for health professionals, caregivers, and for self-advocates. So the CART model is a comprehensive system of care that's organized around the patient, and the components of it include a primary care office that has additional resources and time to develop expertise and office procedures or home care procedures that work for people with more complex disabilities. There are health advocacy services, which are the direct support services for patients who need help to follow through on doctors' recommendations, to provide a history, or to advocate for themselves, to make informed consent decisions. Then there is a Center of Excellence in Developmental Primary Care, which is where the research and the policy advocacy work can be done, and much of the training work that can be done. And then the fourth component of the model is comprehensive health assessment. And that can be done by a trained nurse who does it as a home care model, much like the first visit that we did in your home. Because if we are not proactive, if we just wait for patients to come to us and say they have a problem, that may never happen. And that was part of what I think is illustrative about Aaron's story, is that Aaron and his mother were not able to come to the healthcare system and ask for help when they needed it. We had to go to them and say, how are you doing, and assess how you're doing and make sure that all of his medical needs and his mother's medical needs were recognized and met. We need that proactive piece of the puzzle that isn't there for most people who can access healthcare when they know they need it. And I'm hoping the healthcare reform bill and some of the innovations that are coming out of that will lead us in that direction. But it's going to take a lot of advocacy.
Healthcare Stories, made possible with generous support from the Special Hope Foundation. For more information, visit dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution, Non-Commercial, Share-alike 3.0 Unported license.